hand over to Katie.
Hi everyone. So just before we get going, you might have just heard the recording start. So just to let you know that we're going to record sections where Anushka, I, and Hannah speak today, but we won't be recording any breakout rooms or questions. Do just drop us a message in the chat if you've got any issues with that. But thank you so much for being here today. Before we dive in, we're just going to walk you through what we'll be covering and how we'll work together. So we're going to have some welcome and introductions. We'll look at why menstrual health matters at work. We're going to have a discussion into barriers and solutions. We'll try fit in a nice little break. We'll look at Macc as a case study. We've got a lovely resource pack to go through that we've prepared for you. Another discussion on implementations. Then we're lucky to be joined by the lovely Hannah from Grace and Green. And we'll end with some questions. So, alongside all this content, we just want to set a tone for how we're going to work together today. So, this brings us to our working agreement, which you can see on the right-hand side. These are just some simple principles to help create a supportive and respectful place today. So, we are here to talk about menstrual health, which is, well, it can bring up feelings of embarrassment, discomfort, stigma, especially when we're talking about it in a workplace setting. So we just want to clarify that this is a safe
Okay,
space.
thank you so much.
Oh, please just try and keep yourself on mute. Thank you. This is a safe space. You never have to share anything you don't want to, and everyone can take this at their own pace. So you don't have to speak if you'd rather listen and reflect. Similarly, our full working agreement is just that, again, we really prioritize this being a safe space. We want to make sure everyone is respectful. Confidentiality is important. What is shared here, sorry, stays here unless explicitly agreed otherwise. We'd like you to try and be present. Try keep your camera on if you can, but also feel free to take breaks where you need. That links to taking care of yourself. And most of all, we really welcome curiosity. If there's anything you'd like to add to this agreement, also feel free to pop it in the chat. Thank you.
Fab. So we're going to do a quick introduction. So my name is Anushka. I am in the policy and influence team. I have a couple of work streams, but the one that we'll be discussing today will be menstrual health and menopause co-lead alongside Katie.
So I'm Katie. I'm on the capacity building team at Macc, but as Anushka has just said, we lead on the menstrual health and menopause work at Macc. We're also joined today by Hannah.
Thank you. I am the National Account Manager at Grace and Green. I look after up to 400 organisations, get menstrual health in the workplace, and I'm also the period dignity lead.
Amazing. Thank you.
So just another little thing before we get going. We wanted to quickly recognise gender and menstrual health. So while menstruation mostly does affect cisgender women, it's very important to recognise that menstruation isn't just a women's issue. So people who are non-binary, transgender, or intersex may also experience menstrual symptoms. That's why throughout this presentation and throughout our work, we use inclusive language like people who menstruate. But that said, most of the research, of which there is also very little, but of work on menstrual health, does refer to cisgender women. So if you see any statistics, that's why they may refer to women rather than people who menstruate. Thank you. So let's get started on why menstrual health matters at work. So menstrual health isn't just a personal issue, it's also a workplace issue. And we know that fundamentally it's an equalities issue too. People who menstruate might face barriers to participation at work, whether that's due to pain, fatigue, or also the stigma that might keep you from speaking up or asking for the support they need. The fact that menstrual health is rarely discussed or supported can add to existing gender inequalities. So that might especially be around pay and promotion. So here we have the gender pay gap. We can see that last year it was actually still 13.9% or 1%, which I can't read, in the UK, which is still quite huge given that that's 2024. So the gender pay gap isn't just about salaries. It also can be who gets to stay in work, who gets to take on leadership roles, who might be recognized for their contributions. If someone misses work due to unmanaged symptoms or they have to reduce their hours, They might lose their income. They also might lose visibility within a company or organization, and they might not be able to progress in the same way. Thank you. So we've also got the gender pain gap, which is something I learned about quite recently. So this is the systemic tendency to downplay women's pain. This can be shown up in healthcare, which we do often hear about, but also at work. So many employees have been shown to push through symptoms in silence because they might not want to be judged or might not want to be disbelieved. So all of this comes at a huge cost in the UK. So UK organisations lose millions of working days per year. We see on the screen that it's 3.5 million working days, which that also does link to the business case. So if you're an employer here, we know that employers who take action in spaces of well-being and inclusion, well, they lose a lot less of these working days, but they also do send the important message that health and dignity does matter, and that will benefit all of us. Thank you.
So I'm going to just dive a little bit deeper onto the gender pain gap. So the gender pain gap, as Katie says, it exists in the UK and it's a phenomenon in which pain in women is seen more poorly understood and more mistreated compared to the pain in men. So women's pain is being ignored, dismissed from as young as the age of 10 years old to until they retire. So statistics on the left-hand side saying 4 in 5 women aged between 18 and 24 said that they experience pain that's being dismissed or ignored. The gender pain gap cannot be ignored when we discuss menstrual health as well. So many people who seek that medical support for their cycle have felt pushed back, medical gaslighting, and invalidating their feelings and what they're going through in their cycle. It's imperative that we highlight this issue in line with mental health support, as this gap is very much real. Worryingly, though, women still believe that the idea that they're not taken seriously and viewed as emotional contributes to the gender pain gap. So over half, so 55% of women surveyed that, whereas 27% of men felt the same. Interestingly, though, 56% of women surveyed that the historical bias of the gender pain gap, so that idea that women are kind of expected to naturally suffer that pain throughout their life. So linking this back to the menstrual health example is that the average woman in the UK starts her period at 12 years old. So most girls will start their period between the ages of 10 and 15, but the average is 12. So many girls will sit their GCSEs, their SATs even, on their period, and that pain that comes with a period is sometimes often not discussed or even dismissed. And that dismissal of menstrual pain could lead to a delay of a menstrual condition diagnosis or receive that best medical support that they need.
Sorry, I was on mute. So now we know that menstrual health is a huge issue, but we're also going to look specifically why it matters at work. So these figures that you can see are taken from a CIPD study from 2023. So this study found that 79% of women experience symptoms during menstruation. That's the vast majority of women. Of these, 66% that these symptoms negatively affect their performance at work. Sorry. This means that nearly half of menstruating employees are being asked to perform at full capacity while dealing with physical challenges, often maybe without the support that they need. And yet, 61% of people say that they have worked when they didn't feel well enough due to their menstrual symptoms. This reflects a much wider issue of the lack of conversation, maybe lack of policies available, and again, really links back to the stigma. So we're going to hear from Anushka about more about these symptoms.
So as Katie's mentioned, 4 in 5 people experience those menstruation symptoms, and of those symptoms, 60% will be abdominal cramps. And just over 50% of people that go through menstruation will be feeling irritable. Just under 50% have fatigue and bloating. As you can imagine, these are all symptoms that will exist throughout your working day, which might be quite difficult to manage with your workload. So 40% of people who have periods have irregular periods, which is another case of why it's important to have accessible period products available in toilets wherever you are, just because a lot of people will be caught off guard. 25% have anxiety on their period, and 39% have headaches as well.
So we're looking at why menstrual health matters at work. 49% of people in this same CIPD study said that they wouldn't tell their manager if they had to miss work if it was due to their menstrual cycle. So the statistics are huge, but then when we look at the reasons they gave for this, I think it becomes even more real and you can see why it really matters. So they gave examples such as, I felt the problem would be trivialized, I felt embarrassed, there's too much stigma or taboo. Some said that their manager might not be understanding. Interestingly, some said they have a male manager, which links back to the gender dynamics at play. Some have said that their manager might think their performance would be affected. So there we've got a lack of understanding. My colleagues might not be understanding, same again. And then quite sadly, some gave the reason that they had too much work, which links back to presenteeism again. Thank you.
So I'm just going to quickly go over some menstrual conditions, as I think that nicely links to a lot of the symptoms we were talking about earlier. So menstrual health and also women's health is very much an under-researched area, which means the statistics are not as much as we would like. Something just to reaffirm that is there's 5 times more research that goes into erectile dysfunction, which affects 19% of men, than in premenstrual syndrome, which affects 90% of women. So a lot of the research around menstrual health and menstrual conditions are very much under researched. So these statistics are largely research on cis women, but I want to just share a little bit about these conditions. So 1 in 10 women have endometriosis, 1 in 10 women have polycystic ovary syndrome, 1 in 10 have endometriosis, and 77% of women develop fibroids at some point in their lifetime. So endometriosis occurs when cells similar to the ones in the lining of a uterus are found elsewhere in your body. So that sometimes that could even be in your lungs at very rare cases, but it's in other places of your body. These cells can grow and change in response to hormones in your cycle. So even if you have surgery to get rid of the endometriosis, it can grow back. It's very likely to grow back with your hormones going through your cycle. It's a very painful condition. 1 in 10 have PCOS. So PCOS is a hormonal disorder which is characterized by those irregular periods I was talking about earlier, and it's to do with having an increase in those male hormones as well. So that can have other effects on your menstrual cycle, and also having polycystic ovaries, which are fluid-filled polyps on your ovaries as well. And endometriosis is a condition where the tissue that normally lines in your uterus grows on the muscle layer of your uterus as well. So fibroids can sometimes be painful, but depending on the person, so a lot of people might not even know they have fibroids, but in cases they will need surgery to reduce fibroids if they have really bad symptoms. So there's a lot of these hidden conditions. People don't talk about these enough. People may be going through at work. I'm gonna go over a little bit about period poverty as well. Period poverty is very much a hidden issue in the UK and in our whole global society. So 2.8 million people in the UK are struggling to afford period products, and that equates to 1 in 5 people who menstruate. That has, from 2021 to 2023, in only 2 years, this came from ActionAid, there's been nearly an increase of 10% of the amount of people in period poverty in the UK. And 39% said that they have a higher cost of living, has meant they have to force themselves into using products they might not have already usually choose or would be their preference. And ActionAid also did a report to say that UK has seen a 69% increase in the price of pads from 2022 to 2023. This is an extremely vast issue that we have in the UK and an issue that people almost sometimes forget.
Thank you. So most of us today are here from Manchester's VCSE sector, as that is what Macc specialises in, of course. So we wanted to say a little bit about why this work is critical in our own sector. So we know that the pressures are quite high. Teams can be stretched, budgets are often very tight, and the work we do is very people focused. So in that context, it might feel harder to take time off, to speak up for yourself, to prioritize your own health, especially when the stigma is still there. But then on the other side, we know that the VCSE sector is a leader in inclusion. The sector is rooted in values of equity, of care and inclusion, and of community, very much. And we think that that puts us in a powerful position to lead by example. VCSE organizations are often small, agile, very values led, and we hear that they often are really connected to the lived experiences of the people they work with, be that their workforce or the communities they're working with. So this bit is quite nice because it means that you don't necessarily need a huge budget to start making a difference. What we can do is make small changes within our own organizations, with leadership, openness, and just little commitments to change, and that will hopefully have a ripple effect into the wider sector and maybe the wider world. Thank you. Okay, so we're on to our first workshop. So we wanted today to be really discussional, really building on each other's ideas and thoughts. So what we'd like to think about first.
I'm now recording it again. So I really appreciate everyone being so honest about what you need. So hopefully the next part of the session will be able to give you that clarity and knowing where to move forward. So we wanted to share a little bit more about our journey. So we talked a lot about what you guys need, why it's important that we need it, but how did Mac get here? So a little bit of context. So I joined Mac a year and a half ago now, in 2023, and I was really worried about starting work, because I had such bad periods that I went to my GP. I've been in and out of GP, in and out of hospital checks for my periods my whole life, but on the when I was starting this job, I started getting really worried about not having the support I needed before starting my first job. And it started worrying me that I wouldn't be able to actually excel to my full potential, because of what naturally was happening to me. So I joined at Mac and I saw that we had a menopause policy pending. And I thought that maybe that would be a nice chance to propose the menstrual health policy. So this is the 5 steps that we kind of took. We know that this kind of change can be really overwhelming. It's kind of been said in the groups as well. So what you'll see are these are 5 broad steps. So start with understanding, develop a proposal, share and listen, amend and rework, and then implement. But we want to make this really clear that there is not a linear, neat process. Destigmatization and unpacking a taboo subject like menstrual health is going to take time, just like it took time for the menopause to be discussed more in workplaces as well. We didn't just want to tick these off in order and move on. We circled back. We came back to each step multiple times. We got stuck. We weren't sure about what we were having discussions of. People were sharing concerns. We kept learning. We went back to square one many times. It wasn't about being perfect. It was about being honest, open, and transparent about the process and sharing everyone in the staff force on how we were doing this. So we wanted to share our experience about a bit of, as like a template for other organizations as well, to share our mistakes, our learnings, and with that in mind, I'm going to hand over to Katie.
Thank you. So, as Anushka said, this work is all quite new on the scale of things. We started doing it last year. So it's been a quick process so far, and we're still in it and we're still learning from it. And the first step we took was to really start understanding the issue. So, partly through statistics and research, but also by really, really including the Macc team. So, it was really staff led. So this, as we say, meant using a mix of formal tools like anonymous surveys and focus groups, and then a lot of informal methods like honest team conversations, discussions in the office, just really making sure that we said time and time again that if anyone wanted to come and chat to us or had anything they'd like to feed in or anything they needed, that was a really open and safe space to do so. So this helped us identify not just what people were experiencing, but also what kind of support they actually might need and would make a difference in our workplace. So I think the most important learning for us was that we needed insights that were evidence-based on the wider context, but also that really fit with our organizational context and the people we had working for Macc. Thank you.
So then we went to develop a proposal. So, especially for menopause and menstrual health as well, took some time on applying that understanding that we had, combining the colleague and staff feedback to understand where we could move forward, and proposing this to management. When we got taken to management, we then almost had a bit of a task force of managers for a few sessions to really unpack this work, to really understand how this works in practices, to really critically look at what we could do and see how we could move forward to get that best support that we need. And then that was taken to trustees. So the draft policy clearly laid out that purpose, the aims, the core values, and also what support that Macc could feel they could give, what we think we really could give to support people going through menstrual health in the workplace. This was a very similar stage to what we did with menopause as well. But just to be clear, policy development is not a one-shot process. It evolves through feedback and also that critical part of discussion. There's an open dialogue at all times through this process to make sure that we were hearing everyone's voice and how we could potentially move forward with this.
Lovely. So next, we continued with what might seem of more of the same. We really wanted to share and listen to more. So we shared the policy draft widely. We shared it with all staff, any leadership, any trustees. We, in some cases, presented it, but more of the time it was just a conversation. We really, really wanted to invite feedback again. So anyone who'd missed the first channels or hadn't quite felt ready to feed in yet had a space to do so. They could ask questions, raise concerns, offer suggestions was a huge one. I'd say the policy that we wrote first is completely different. I'd say it's maybe 10% the same as the one we've got now. So yeah, I think this is quite a simple step, but one of the most important to make sure that the people we work with feel ownership over the policy, to make sure leadership really are behind the policy and want to actually do the actions that are in there, as well as just write a policy and have it written. Thanks.
So to align with that, we then started to amending this process. So this is almost like near the final stage. So Matt used this feedback. We gathered it to fine tune the policy. And as Katie said, the policy is very much been very evolved since we started. So it's really different to what it was when we began with. We wanted to make sure it aligned with existing structures and procedures. So like sick leave, and our flexible working policy and things like that. We wanted to make sure that we interlinked it what was already going on. We really wanted to make sure that the actionable steps were really important and realistic. So did we feel like staff would actually take these actions on if they felt like they needed to, and what was missing if they felt like they couldn't? So tools like our own template, but also tools like we've made a Macc policy template, which I'll go over later, but also having all the resources to really ensure that we are sharing that widely. And once that got signed off, it was ready to implement.
Lovely. So with our policy finalized, that's where the real work began for us. So we had to recognize that implementation of lots of new things doesn't just happen overnight, and it happens gradually, especially when that relates to maybe addressing stigma or shifting norms in the workplace. To make sure that this change did keep happening, we kept staff and trustees in the loop. We tried really hard to celebrate progress where it came, and also, quite honestly, shared the lessons when we were learning them. Importantly, we don't just want to rely on the document as a policy. We want the team, we want leaders to be really committed to the values within the policy so that the actions actually come to fruition. We also want to say that it isn't just a in and out process. So as your team evolves and your workplace evolves, so should this policy And we really understood by the end that real change meant that you had to keep going back to the beginning and revisiting, refining, and improving. And we'll keep doing that now. I'd also just like to mention here, so in my breakout room that I was in, someone mentioned that they had other policies to put in place first. And as a small organization, you might need a recruitment policy before you quite get around to your menstruation policy. So that's completely valid, it's very understandable. But what they also mentioned is that some of the actions that might be mentioned in a policy were already starting to take place, and that this really cultural shift was already happening. And I think that's really just links back into this idea as not a linear process. So yes, you might not have taken a step by step to write out a policy, but you're already coming up with your ideas and interacting with your team that will eventually go into policy, but most importantly, are already supporting the needs of people who menstruate now. Thank you. Okay, so we thought we'd quickly say a bit more practically what's in our policy, because that was very much the process we took, but we wanted to say what we really included. So yeah, our policy is designed to support staff who experience menstruation in a way that's inclusive, practical, and grounded in well-being. Our aims, there's quite a lot, as you can see, but we want to essentially break stigma, normalize conversations, and ensure that no one feels they have to choose between managing their health and doing their job. Thank you. So practically, here are some of the things that as Macc we've committed to. So we want to start by breaking down stigma. All staff will or have attend a mental health awareness session in their first year, and we'll do refreshers every 3 years. For line managers, which has already come up a few times in conversation about maybe gendered line managers or even just age differences between line managers and their staff. But we have compulsory line manager training in their first year in post, all done as a big group. But this focuses on understanding menstrual health and responding compassionately and practically, and being able to put the support into place that staff may need. We've had really good feedback from these, and we've heard that the sessions were more crucial for shifting culture in the fact that they normalized conversations and made people feel more confident asking for support, even if that's just as a first step. Another thing we were quite big on was explicitly acknowledging the link between menstrual health and mental health and well-being, because this is something that came up in our focus groups and in our conversations, that staff, either at other works or just in the past, had been, well, they felt that, yeah, they'd been told menstrual health did not link to their mental health. And, just to get on with it, everyone goes through it, something that all women have, for example. So now to counter this, we highlight it in all of our communications and regularly signpost staff to mental health services. We also have Menopause and Menstrual Health Champions. This is a group of people who've signed up to come forward. There's just 3 of us at the minute. There were 4, but someone sadly left. But they do things like, well, we're going on champion training to be more of just a listening ear, but also are available at any time. And we do things like regularly send out reminders, just have little things in the office, that kind of thing, a little team of people who you can come to. And finally, we've got this policy and some of the actions embedded in new staff inductions, because we want it to be from day one that this is a supportive environment, rather than that when you get to a place where you feel like you need support, then you have to look for it, and then you might find it's there. So I think that's quite important too. Thank you. Oh, there's so much more.
No,
Sorry, I absolutely wasn't finished.
okay, keep going.
We've got the way we log our leave if we're sick is on an online HR service. We've got a menstrual health category for this. It still counts towards sick leave, but it just is an option that you can choose to take yourself if you would like to give that as your reason for being sick. our menstrual products, which we will hear more about later, are freely available in the bathrooms. And we've put huge emphasis on supporting reasonable adjustments, which are tailored obviously to each person, from access to hot water bottles, cold drinks, etc. And then in some cases, we offer special leave for menstrual health related symptoms, which goes through your line manager and can be discussed on a case by case basis.
Kind of want to see where we are now. So that policy is very much a framework. So something that came up in our breakout rooms that I want to address is that a policy is very much a starting point. It is not the end point. So frame that it's almost acts as a framework and a foundation to move further. So it's not just a here's a policy and that's it. It's a very much an implementation stage. Culture shifts have to be done by training and raising awareness. This is a very taboo subject and is something that we need to address intergenerationally as well. Um, we've come a long way with menopause, so it can be done. It just takes a bit of time. So it's not restrictive, the policy. So where we are now is we've introduced menstrual health and menopause policies. We've made sure they're separate because they might need different support. But we do acknowledge that they very much interlink, but we think it's important to address them separately as well as in how they work intersectionally. We've held staff and line manager training with Hempicked and Manchester Mind. This has been done, so all staff have been trained on menstrual health and menopause, and that was a mandatory process as well. And for new staff that we have until we do the 3 year refresher, which should be in 2027. Between then, we've got a pack that I've made for new recruits, which includes all the resources that we have and links to like other charities who have done awareness sessions. So Endometriosis UK, for example, and CIBD, they do their own sessions on free online, which we will share with everyone afterwards as well. We've appointed menstrual health and menopause champions, which I'll go over in a second. We've got sustainable and ethical period products in all bathrooms, and that also has meant now we've moved to the St Thomas Centre in Ardwick. That is now available to people who are coming in to use the community centre or use the space. So we've now also tried to begin to influence wider employment policies. So in January, we submitted a written submission of evidence to the government's Employment Rights Bill to ask for this to be included for all workplaces and for it to be a supportive process. So not for it to just be every workplace needs a menstrual health and menopause support. This is how you do it to make sure that we don't leave people on their own. So a little bit about the champions. As Katie mentioned, we have 3 at the moment. We are always looking to recruit more in the organisation. They're there to keep menopause and menstrual health on the agenda. So that's all the awareness days, keeping honest conversations with staff, but also to advocate for staff if they need it. The champion's there to be supportive, and that's the most important element of the champion role. Something that came up in our breakout room is about having that designated staff member. And this is a really good use of the champion model because it will mean that if anyone has any questions, it can go directly to champions as well as their line managers as well. Other practical ways can be having hot water bottles at work, and the black cardigan model, which is where you have black cardigans somewhere in a locker or anywhere that would be easy accessible. So if anyone bleeds through their clothes, they can wrap it around their waist, for example. That's another practical way of helping people. We're proud of how far we've come, but we're still very much in our journey, and we will continue to share what we've been getting up to. So a little bit about Period Dignity Partners. So we have partnered with Grace and Green, who we'll be talking a bit later on. So we are proud Period Dignity Partners. And the reason we picked Grace and Green is because they're sustainable and safe period products. It allows for that inclusive work environment because it's another way of talking about taboo and dismantling that taboo. They're in all toilets. And another reason for that is firstly, because people who are non-binary or transgender may need those products. But also another angle to it is that if someone's going through period poverty and a person goes into toilets and want to take some products back to their child, then that's another reason to have it in all toilets as well. Also, Grace and Green have amazing free education that I think is really important as a culture shift for this to end period shame. But Hannah will go over a bit of that later. So the things I'll just read over a couple of them. In the past, I got jokes and comments about my menstrual health, and I was humiliated and isolated. These jokes severely affected my mental health, and that lack of support only made things worse. Now I feel reassured, knowing that people are being taught about the harmful effects. It's a relief to finally work somewhere that actively works to create a supportive environment. Often in the past, I felt frustrated and isolated, but now with training and practical support in place, I feel confident and supported. I no longer feel like my mental health is something I need to hide or apologize for. And last one I want to point out is someone said, as a man, my understanding was very limited before attending the staff training. And it was great to challenge my ignorance and to be in the space where staff felt comfortable to share their personal experiences, which I think is a really important one to highlight. I'm going to quickly go over this, but I want to make sure we have time for questions at the end. So this is our resource pack, which we will share. It's on our website now, so I'll share the link and I'll share the PDF as well, which includes a policy template that you can use. It has loads of resources. I see something in the chat about the trans and intersex community. We've got loads of resources on there as well. So we've got links to other campaigns. We've got links to inclusive language, links to your actual menstrual cycle, period poverty, reports that you can read. Honestly, it's all in there for you. So please utilize it because it's a really useful resource pack. And we're happy to answer questions on that at any point if you ever want to email us.
Lovely. So now that we've shared Macc's journey and you've had some time to reflect on your own organization, we're going to pop back into breakout rooms and think about next steps. So we want to start thinking about bridging the gap between the ideas we might have and action. So we'd recommend you think about something you're confident about. Maybe it's starting your conversation, making a case for policy, having free products, and then building on what we spoke about in the last breakout room, something that you're still unsure about, and then building on this essentially. We'd love you to feed in and come up with any potential solutions to each other's ideas. This will be a slightly shorter breakout, and then we'll come back and feed back together, answer our questions, and try to really build on this.
This is an education. So seeing what you've done is incredible. So I need to give you the applause where needed. So in terms of Grace and Green, this is currently the disposable period care that Macc are providing. I'm going to touch upon today, I'm going to focus on sustainability, what we do for period poverty, and just a bit about Grace and Green as a whole and some of our benefit schemes. So in short terms, our mission really and our three core pillars is sustainability, access, and education. We call ourselves an antidote to unethical industry titans, being the highest ranking B Corp in disposable period care. Anyone that is up on B Corp, basically a score of 80 or higher, is required for B Corp certification. That means that you're doing all the work that you should be doing externally and internally. Our score is 146.5, so obviously it's huge and it's something we pride ourselves on massively. A lot of that is down to our work in the ethical period care that we supply and the period dignity scheme that we're doing. So you can next slide, please, Anushka. So there was a recent study recently about various toxic metals being found in tampons, which did shock a lot of people. Obviously, when we're working in menstrual health, we are very aware of it. If anything, it gave us a really good chance to talk about sustainable period care even more and the positive impacts of using disposable sustainable period care. So we are 100% certified organic bamboo and cotton in all our pads and liners. Our products don't hang around. They're, the biodegradable materials. We're free from chlorine, bleaches, pesticides, other synthetic materials. We don't have any of the toxic metals that you will find in any of them tampons. We can make it quite clear that we are very, very healthy for your vaginal health and peace of mind. Next slide, you can actually move on from this. It's just more of a quote that makes people think in terms of what we're doing to landfill and the planet, because when people think of common landfill items, they tend to think of food waste, plastic packaging, batteries, clothing, unrecyclable items, but period care is actually a significant contributor to landfill, and it's contributing to the overflow and pollution. So on the next slide, you will see the stat, which is honestly really quite scary. So 4.3 billion products in sea and landfill a year in the UK is just period care. So a lot of your shop bought or your classic period care, a lot of people don't realise this is made from 90% plastics. That's what tends to shock people the most. And there's up to 3,000 chemicals in conventional tampons, which is why Macc have come on board with a sustainable period care brand. I feel like I'm fast forwarding this because I know that I've only got a few minutes, but I am going to go into period poverty, which is, some of this was already touched upon with Anushka earlier, actually. So you have actually spoke a lot about this, and you spoke a lot about what we talk about is a hidden crisis. Right. So 1 in 5 women in the UK have struggled to afford or access menstrual products, which was in the 2022 report. And 49% of girls and young women were missing at least one day of school or college, which was because of the lack of period care. So we tend to look at 3 pillars with period poverty because it's a really, really broad subject, which is usually access, facilities, and education. So a lot of it with the education is 1 in 10 people who have periods have not been told to speak about the period in front of others, which can then lead to them not using the right period care. So it's not all actually linked to access. It's also massively linked to education as well. It's also lack of safe, private, and hygienic spaces to manage menstruation. We've had some really heartbreaking stories of so many girls in schools that are using tissue when they're heavy bleeding. So we're doing a lot of work on period poverty. In link to that, you can go to the slide which says types of period poverty. We do a lot on access, affordability, stigma, culture, and environmental. Like I said, I could speak about period poverty for a very, very long time, but I'm giving you a much quick version here. But there's a lot of stigma that comes with menstruation still, and linked to the discussing or buying products or not wanting to, or the hesitation to asking for them means that people aren't using them. We also, in terms of access, which Grace and Marine do a lot of work on, we donate 2% of our revenue to period poverty. Refugees and people in crisis situations have no access to period supplies at all. Rural areas, remote regions may have limited stores or supplies. So we do a lot in terms of our donations. We've donated £130,000 of worth of period products to charitable causes since 2023. We are really transparent in terms of how much we actually donate on a report each year. We partner with non-for-profits to donate period products. That includes, in terms of local ones, we've done a lot with Salford Food Bank, we've done a lot with Thumaeus Charities, and our national partner at the moment is Women's Aid, which we're really, really proud to be working with. When it comes to period poverty, a statistic that worsens significantly is for those in fleeing domestic abuse. So we are going to be donating free period products to Women's Aid for the whole of 2025 across England in all their community spaces, refugees, and all their safe houses. We've had some amazing feedback that's come from some of the service users because of this. It's the last thing that you want to be thinking about when you are in such a traumatic situation is the fact that there isn't any period care supplies on hand as well. So we are incredibly grateful for the work that we're doing with them, and also it's a partnership that we want to carry on really. We are currently in talks to start doing it in Ireland as well, so that is pending. We're striving for dignity for all, and Women's Aid was something that we felt we really, really wanted to support with internally as staff. So we're trying to do a lot of volunteering on top of what we're actually doing as a company as well. So with that, because we do get a lot of questions sometimes on if you're a VCSE, it came up a lot as well with, I noticed in the workshops about there can be problems sometimes with like budgets or even know where to start. So quite openly in terms of charities, we have a charity pricing structure where we will discount it heavily. So on our retail price, we'll take 45% off on tampons and 50% on pads and liners. So if anyone is ever interested, this isn't selling Grace and Green, I'm just talking about supporting it as a whole in terms of how we can support a charity, because I'm well aware that a lot of the challenges that come up when we speak to charity organisations or VCSEs, they say that they have a budget problem or it's not part of their budget within even in the bathrooms. So we do have a pricing structure, and it's something that we want to do because we obviously want to support you and want it to be accessible to everyone. So this is something that we can actually help with. And if you did, just so you can understand a bit why Macc maybe came on board with us, as well as the providing your employees with free period products, it's helping the stats. You tend to have a healthier, happier workforce. Also, it's hitting ESG targets. So in terms of reducing single-use plastic in your workforce, inclusion and diversity, it's obviously you're demonstrating your commitment to gender equality, free talks and training, which I will go into. We have a range of training and lunchtime sessions, which I've noticed a lot on the workshops that it's even having a starting point as to even know where to start. And I find that the talks that we do are a really perfect starting point to tackling period stigma, because you can invite all your team onto them. You can ask anyone who you want to go onto it. If anyone's unsure, you can get them to come onto one of our talks. And I think it's a really good starting point for just general communication about it. And as I said earlier, we donate 2% of our revenue to tackle period poverty. It's something that we do a lot of work on. In terms of our training and talks, Anushka said this earlier about our education packages. We do a members comms, which is a monthly digital download. So we'll offer a PDF, which will always have an education top piece on that, which you can share and send out to your team. Because I know that a lot of you could have a really small team and you just do not have the time to be able to do any of this work. So we're almost providing it for you to be able to share out to your team. And then we do quarterly online lunch and learns. We've got one coming up soon in a couple of weeks. So every 3 months, we invite you to a talk. Again, it's especially as a starting point, it's great for you to be able to attend them. And then we can actually also do annual bespoke pop-ups. So if it was something that you were wanting us to come in and actually speak to the team, or there was something that you felt that you could benefit from, we can actually come in and chat to you as well in person. That can range from whatever it is that you're really kind of wanting to have as your focus. And then can you go to unlock employee perks, please? I'm talking as I'm like not saying next slide, sorry. So you can also get employee perks as part of Grace and Green, which is why we want the employees to get like a special bespoke code. So you can get up to 30% discount, and it also includes some of our like lifestyle products that are online as well. But you can get a subscription if you're an employee that works at the brand that has brought on board Grace and Green as well. And we offer posters that are really good for signposting. So I know a few people said that they hadn't even mentioned that they were providing free period care in their policy, which is actually a huge part of starting to dismantle the stigma with, talking about menstrual care in the workplace. And our posters are brilliant for that, because even just we've had so much data and feedback on people saying just seeing a poster saying we supply free period care in this space and we can offer you a discount on period care has actually made them feel a lot more seen and heard, in terms of, wow, I don't actually have to worry about that, especially if you've got irregular periods and you need to get period care all of a sudden. It's really supporting people who are guests who maybe come in as well as employees. So yeah, that's something that I noticed a lot that came up, that people were saying it not even been mentioned. And I think that is a huge part of it, to make sure that you are talking about that, because it's a huge part of dismantling what we're doing. And yeah, that's me.
Thank you. Hannah, I'm sorry for the very quick run through.
Okay.
And I'm very aware that we are a couple minutes over just because we've had so many great conversations. So I'm sorry to anyone who've had to run, but we will send all of these slides and contact details. So please do get in touch. We would wish to have been able to go over some questions, but what I will do, these are me and Katie's emails that will also be put in the email follow-up. And we'll put a link to Grace and Green's website and how you can get in touch with Grace and Green as well. But please do email us questions if you'd like, or if you'd like to have another conversation with us, we'd be more than happy to chat further. And also, please remember our resource pack, we will share it over, which also has links to Grace and Green. The questions that came up in the workshops, we'll share a bit of information about what people have said, and we'll try and answer as many of those questions as possible. Thank you everyone for coming. Genuinely thank you, and for all of your amazing contributions. We really, really appreciate it.